So, ready admit ya, one per one people will come. And hello, can we start, Dr. Marco?
Yes, I'm ready.
Okay. Halo, good evening. Uh, Selamat sore, guten Abend, atau whatever. Everybody, there is a few of my friends all over the world. Yeah, mostly they are come from Indonesia, and Dr. Marco patients may be already in Singapore, and few of my friends in London and Paris also want to join us today. Thank you for joining us today. Selamat malam buat Indonesia. Selamat datang di Zoom hari ini. We are live from my IG and also from Zoom and YouTube. So after a long time, we are talking about only COVID-19. We are already so bored and we want to talk something new. It's about beauty. Yeah. So we have our special guest today, Dr. Marco. He is a Brazilian plastic surgeon. He practiced also in Singapore. Hello, Dr. Marco.
Hello everybody.
Yeah, he is also my teacher, and I was by him when I was in Singapore. And he has a long experience in body liposculpture. He is one of the pioneers in Brazilian butt lift technique, and also in silicone butt implant. He is also worldwide pioneer in minimally invasive endoscopic, plastic, and robotic surgery. He has received a lot of international awards for his techniques and contribution in plastic surgery. So basically, Dr. Marco adalah seorang yang sangat is very professional untuk menjelaskan di bidangnya mengenai Brazilian butt lifting atau apa itu memiliki pantat yang seksi tapi tetap aman, safe dan healthy. So, hello Dr. Marco. Hello, can you tell me a little bit about your activity now?
So, Marta, tá dando eco. Baixa pouquinho aí o som. Is this COVID time, after that break, and people cannot travel around the world, then is very, very hot, the market of plastic surgery. Here in Singapore, I'm being very, very, very busy with the Singaporeans that even if normally about almost 50% of my patients are from Indonesia, they always fly from Indonesia, for many parts of Indonesia, mainly Jakarta, Surabaya, etc., to Singapore, and they represent normally close to 50% of my activities here. But during this COVID time that we are basically doing local patients, I'm really busy with the people that live in Singapore. And it's not happening only in Singapore. And in America, the same, even the number of COVID cases in America is quite high. In Brazil, the same. Canada, the same. People are so bored of staying home and they keep watching themselves in the mirror and eating, and they just decide that cannot travel, cannot do much, then going for plastic surgery. It's really an unusual avalanche of patients coming, requesting, fighting for a space to have the surgery done. The other interesting thing is a lot about eyes, because the area that people keep seeing themselves with the mask, just see their eyes. So many requests about eyes operation these days, and also liposuction, the home eating.
Ya, thank you. Ya,
Yeah, but
betul banget nih teman-teman di Indonesia. Okay, so we have long holiday last time, yeah. So it's a very good time to do surgery now. Not so many activity like before, yeah, Dr. Marco.
yes, the people are many home, working for home, the husband at home that help to take care of the children, and patients want to go more and more for plastic surgery. But Going for our subject, that butt. Butt lift, Brazilian butt lift, butt implant. Why? People ask why butt surgery became so popular. Why people are so focused in butt operation? Is the operation that grew more, the number of cases in the last year was butt surgery, butt lift, butt augmentation. And before was a lot about breast, but now the number of patients looking for butt reshaping is very high. And why?
Okay.
People ask why.
Okay, so everybody want to know how the procedure, is this safe or no, itu aman atau tidak. We will start directly our program today about Brazilian butt lift. If you want to ask, jika yang mau bertanya, you can ask here through the chat box here. You can type, you can ask about is that safe and everything to Dr. Marco, and I will also introduce a little bit about patient safety later. So time and place belongs to you, Dr. Marco. Please.
Okay. So then I was saying that why butt and six-pack abdomen became so popular, because people admire more and more those that are fit, that have a healthy diet, that doing exercise every day, and the areas that can tell, let's say, breast, you can born with breast, big breast, beautiful face, but those that really have a lifestyle of doing exercise, but they normally will have a nice flat tummy, six pack, and a fit legs and butt. That's why I think is the focus nowadays, because fitness and the proper diet is very important, the lifestyle. People start to keep attention that in those areas that tells more about how fit, how active is a person. And the butt became more and more popular. Well,
Yeah.
talking about the two different techniques.
So can
Okay,
you?
but back to the beginning. To have a beautiful butt is important to do also practice some exercise to have a strong muscle. Then
Mm,
the number one way to have a beautiful butt is active exercise. Then, if the person is has no genetically have a small muscle, have no muscle, even if doing exercise cannot really build a beautiful muscle in the gluteus, then, and they don't have also fat to transfer, then will be the butt implant, silicone butt implant. That will be the technique for those that cannot build a muscle, cannot refill with fat. If I can show you some slides in my PowerPoint, here I will show the difference between the butt implant and the breast implant. Can I uh, share my,
yeah,
can
sure.
you share my PowerPoint?
You want to share or we need?
Yes.
I want to show some slides. How do I click here, or you allow me, how, or I just click share?
Yeah.
How does it? Hot disable participant screen share. You have to enable my screen.
Yeah, we have already share screen.
Yes, you can.
Yeah, yeah. Share screen. Okay. So what then we you can see it's not going down. Okay. And this one here is the breast implant, silicone breast implant. That's the shape. And this shape is the butt lift, the butt implant, silicone. That is firmer, more fuller, thicker silicone capsule, and can be gel, like the breast silicone, just a thicker and stronger gel, or it can be a bit solid. The solid in America they use more the solid. In Brazil and around the world is more the jelly one, because softer, and the solid one can have more extrusion and so. But anyway, this implant is placed inside the muscle or under the muscle. Under the fascia is the one that carries more complication. Then is a small cut in the intergluteal fold, and putting the implant there. And the implant always you create a nice upper pole of the butt. This lower pole here is still have to have nice muscle or refill with a bit of fat, and sometimes liposuction in this area combined. Then a silicone butt implant doesn't carry many complications, less than breast implant, according to many studies, because it doesn't tend to have the capsule contraction, and it stays quite well. Just in the early stage, that can have some case of infection because too close to the anus when you go to put there. But to me, is the last technique to choose. I always give preference to work with fat, because fat is from your own body, and when we talk about building your butt with fat, it means it's a life sculpture. We will remove the fat from these areas that we don't want to create a nice curvature, and at the same time augment the size of the butt. The advantage is because is from the own body tissue, and don't need to never change and just stay there. Part of it can be absorbed, but uh, is the number one technique when someone have fat in many areas that can be transferred. Types of butt, shapes of butt. There are different shapes of butt. A bit square when you have fat localized in the hips, love handle area, and the outer thighs. The round one, that's the favorite. The big round ones, that more the Negroes type. The big V, that's a bit hanging and long, but then the heart shape, that were another one that quite favorite shape, and the inverted V shape. Then depending what the shape you have and the shape you like, we will sculpture. The donor areas are the most frequent areas are from the hips, outer thighs, inner thighs, and knees. We will remove the fat from those areas, and then we can inject into the gluteus area. Any do you need to explain anything for those uh, check if there is any Indonesian that needs some translation, or they are
Yeah.
going well?
Okay, if there is some people want translation, yeah, I can translate also. Maybe you can after you say, and I can translate directly, Dr. Marco. Hello.
Okay. Repeat to translate, or ask them if they want translation or not?
Yeah. Some of them, I think.
Everybody understand? Yeah. Okay. So the way we do, we go with a liposuction to Brazilian butt lift. Brazilian butt lift, then different than butt implant. Butt implant is silicone butt implant, similar to a breast implant. Brazilian butt lift is liposculpture, collecting the fat, separating the fat from the blood, from the liquid, then centrifugate or that, and then inject it in the area that you want to create a nice shape.
So, di translate sebentar, I translate a little bit. So, basically ini adalah dari fat yang kita nggak suka, diletaknya di mana. Terus kita masukkan, kita lakukan liposuction, kemudian we collect the fat dan akan di centrifuge dengan mesin sentrifugasi. Kemudian nanti akan diinjekkan ke bagian-bagian yang seperti pantat, di mana yang membutuhkan lemak. Jadi lemak yang tidak diinginkan dipindahkan ke daerah tersebut. Seperti itu.
So then when we is about this, you see, we remove the fat from this area here. It already give a much nicer curvature. Just with this, many times already beautiful enough, just a liposuction in the areas that have excess of fat already can improve a lot the body. And many patients that already a bit full or a bit big, they even don't want to have the fat transfer. But if you don't have enough butt, then we take the fat and transfer the fat to the butt. So we were before, me and Dr. Christabella, we will talk about the safety because, okay, safety in these procedures. The silicone implant is quite safe because it doesn't leak and so, but we don't know in long run if have problem. The location is different than the breast implant. The breast implant is very easy to remove and replace because on top of the chest, okay, no, doesn't go to anywhere that can cause problem. Inside this area here, if there is a complication and is deep near to the nerves and muscle, is a little bit more complicated than a breast implant, okay? That's why it's not the first choice. It's only for those that dream of having a nice butt and don't have fat and even doing exercise, they cannot get there. Then we have to use silicone implant.
Yeah.
The
So
fat,
the best choice is from fat, yeah, Dr. Marco.
in terms of long run and for patients that have fat, yes.
Okay.
Building muscle is the first one. Sculpture in the body with fat is the second one. The third one will be the butt implant. So, but what are the risks that people are afraid about this fat injection? That the name is should not be injection, but should be fat grafting. Grafting because the living cells to graft there is harvesting with liposuction and grafting inside the gluteus. About 4 to 5 years ago, when it became during many years since 85, I'm doing this in Brazil, and many Brazilian doctors doing a lot of Brazilian butt lift. But then suddenly it started to be more popular in Colombia and in America, and they exaggerate in putting too much fat and in the deep layer, deep under the muscle, where there are big veins, and if hit the vein, traumatize the vein, and inject a lot of fat, can cause fat embolism, and there's a few fatal case of patients that die because of the technique that the way they start doing. Then the last few years, after deep studies, there is some changes in the technique to make it safer. We do not inject deep inside the muscle near to the big veins to avoid the risk of fat embolism. Okay, that
So
wants me to talk about this.
injeksi atau bukan injeksi ya, kayak pemindahan lemak dari tubuh lain ke pantat, ada juga resikonya yaitu adalah emboli atau penyumbatan pembuluh darah. Tapi jika dilakukan dengan dokter yang tepat, dengan surgeon yang certified, hal tersebut akan bisa dihindarkan. Seperti itu conclusionnya. Okay.
So the advantage of this technique, and this technique is a technique that is very popular because we do very frequent, is liposculpture, that will remove all those areas of fat that the patient doesn't want, already reshape the body, and plus the butt. And later I will talk about more utilization for the fat to complete, because then when you go for fat and you have enough fat to do the gluteus, sometimes we do the butt, the gluteus, and at the same time a bit in the face, a bit in the hands, and I'll go at the end go through a little bit to show more things, because fat, let's say fat is gold. Before people just hate the fat, but no, but fat nowadays consider fat is gold. If you have fat, you can keep yourself younger in the face, in the hands, and so transferring fat, shifting the fat from one area to another area, not only for the gluteus, but sometimes even together with the breast implant. We do a breast implant plus a bit of fat on top that make nicer the aspect of the breast, combining with the breast implant with fat grafting. Okay, then there's a liposuction from many areas. Oh, how safe is liposuction, and how much fat we can take from one patient in one go? Yeah, the number is maximum 7% of the body weight. Like say a person with 100 kilograms, 100 kilos, we can remove 7 kilos. Then a normal person with 70, 65, 70 kg, we can take 4 point something, maximum 5 liters of fat. And from one region is more is safer than from many regions. If you take from many regions, more trauma, then you have to take less. Other thing that people ask, can I store my fat? You take everything today and you keep in the fridge to using bit by bit. No, I already tried this, but the fat doesn't survive well, and there's more risk of complication like infection, and the fat die if come in the fridge for so long. Then we just do enough amount of liposuction to use one time, like I say, and how much you can put in one gluteus, each side of the gluteus each time. Normally 350, maximum 400 per gluteus, per side. Then if you have much more fat, you leave fat in your body to do a second section to make it bigger if you want to make it bigger. Okay? Anything that anyone want to ask?
Yes ya, kalau ada yang mau tanya boleh di chatting, you can chat directly to the chat box.
Yeah. So which method is the best? Which instruments the best? Because people always talk, call the office already asking, Dr. Marco does Vaser or does ultrasound. There is a lot of advertise about these things, and what's important is if you are doing fat transfer, collecting the fat to use in other areas, we should not use laser, vaser, or any kind of machine that destroy the fat. Should be just harvesting the fat with the vacuum machine. Then the fat is more healthy to survive as a graft. Then what the different they have a working tip that help to dissolve and to kill the fat and to remove the fat, this device, or when just harvesting. What important, what matters? Is the machine? No. Is the experience of the doctor. If you have a formal training, not just a weekend workshop that have seen many accidents with liposuction, is in non-well-trained doctors. People that didn't have a plastic surgeon takes like 6 years studying medicine, then another 6 years studying general surgery and plastic surgery. And some GPs, dermatologists, they never study surgery and they start doing. And then they don't have hospital privileges. The hospital do not accept them to do inside the hospital, and they do inside the clinic. But Dr. Christabella will talk more about this for you in terms of patient
Patient.
safety.
Okay.
Okay. Then, but just introducing this. The other thing is which anesthesia is safer for liposuction? General anesthesia. The International Society of Anesthesiologists and so stated that general anesthesia is safe. Only if I do a small liposuction, okay, local anesthesia. But a body liposculpture, general anesthesia is safer because the patient already with the intubation, airway guarantee, then is already safe. What the most accidents happen when the patient collapses and the doctor cannot save the patient the proper intubation. I go and show a bit faster some real things, the way we draw the patient, all the areas, the way we remove some fat and separate the fat, preparing the syringe, separating the syringe, injecting the area that you want to do, injecting the butt, showing transfer from one leg to another leg, other areas of liposuction that and fat transfer that you do, that I'm doing since 87, this case, making facial rejuvenation or even repairing some defect after accident. Fat is being the number one nowadays for facial rejuvenation. Is the best filler. Okay, then fat we can use for many things. One of the most popular use is being the fat grafted to the gluteus, but for the face, see how shining become the face after doing some grafting here and there. Or people that don't have enough cheekbone, we can increase the cheekbone. Or smile lines for all these areas, lips. Hands is very popular to do it for the hands to make the hands younger also. Okay, and I will pass to Dr. Christabella, but just say that always we do a complete checkup in our patient that we check the heart, the urine, the blood to be sure that the patient is eligible for that. Any surgery carry risks and complication. A very careful surgeon and a qualified surgeon can reduce the potential risk. And no one surgeon can say zero risk, but have to say zero negligence. Take care about all the details to make it very, very safe. Thank you very much, and I'm ready to answer. But first, Dr. Christabella will talk about patient safety. Just
Okay. I
say a few words about Dr. Christabella.
Thank you for the presentation, Dr. Marco. I will, as he requests, Dr. Marco requests, I will talk a little bit about patient safety.
Yeah,
Okay, can you?
but let me introduce you. Dr. Christabella is this young, beautiful doctor, very dedicated to learn. She always go for learning from the best. Now
Yeah,
she's doing this training in Germany because it's a very good place. If she decide to come back to Indonesia, You have one of the best plastic surgeons
No,
ever.
but
Very smart.
unluckily Indonesia reject outside doctor, so maybe only in Singapore, Switzerland, or UK or European.
I
So
think they change in the future. And they
yeah,
open special for you.
okay. I will start the presentation about the patient safety. Yeah. So I will talk a little bit. Okay, next. A little bit about after operation that I know that I learned here in Germany. So we need to avoid atau harus dihindari 20 hari untuk duduk dalam waktu yang lama, like a long flight, a long driving, itu 20 hari harus dihindari setelah operasi. Kemudian sebaiknya tidur selama 20 hari ini dengan jadi telungkup, bukan telentang seperti biasanya. Kemudian sebaiknya disiapkan hari-hari sebelum operasi itu 2 minggu off. Jadi jangan cuma seminggu minta off. It's better to prepare 2 weeks at least to off to do this surgery. Ya, next. Dan kemudian tidak boleh 6 minggu, sebaiknya tidak dihindari 6 minggu melakukan aktivitas sport yang berlebihan. Kemudian kapan kita bisa lihat resultnya? When can I see the result? So, hasil operasi bisa terlihat biasanya 4 minggu udah bisa lihat nih, karena sudah nggak bengkak, it's not really odem or there is what is this inflammation, yeah. So but when we can really see the result, normally we can see after 4 until 6 months, 4 sampai 6 bulan kita bisa lihat hasilnya yang seperti apa. Tapi jangan lupa tetap harus menjaga kelembutan dan menjaga di bagian terutama bagian pantat untuk bisa perawatan kulit dengan baik untuk mendapatkan hasil yang memuaskan. So we need to do treatment also, not only from inside, also we need to repair also the structure of our skin. Next. Yeah, next. Yeah, next. Oh ya, ini what is the dangerous? Jadi kalau apa itu dangerousnya kalau tidak dilakukan oleh plastic surgeon. Banyak tuh salon-salon di Indonesia yang melakukan suntik silikon, suntik di mana-mana. It's really, really dangerous. It's not about, so please jangan, don't only rely, oh it's cheap, it's really good. No, cheap but safe. Do you want to save or only beautiful? For me, I will prefer beautiful and healthy. So ada juga yang pakai injeksi yang silikon cair dan lain-lain, itu sangat berbahaya. Kemudian daerah yang operation yang tidak steril atau unsterile operating area itu berbahaya untuk bisa terjadi infeksi. Kemudian injeksi yang salah yang dilakukan oleh atau pemindahan lemak yang salah itu bisa berbahaya fatal, bisa terjadi emboli, yaitu gumpalan lemak tersebut menyumbat ke dalam jantung dan bisa menyebabkan kematian. So it's really be careful doing everything, injection, filler, or everything. Please be sure that you know the doctor and everything. Okay, next. I will talk fast about patient safety. Next. Yeah, please surgeon that you can trust. Minimal, yeah. Plastic surgeon is really hard. We need little, so kita harus 2 tahun itu minimal general surgeon. So next we can do plastic surgeon. So nggak bisa itu namanya workshop yang only 6 months and you become a plastic surgeon. It's just a bullshit. I'm sorry to say. We need to choose a surgeon that we can trust. Yeah, next. So, apa itu dilakukan di klinik atau hospital, one day surgery, and what kind of anesthesia. And you can Google JC1 is a standard facilities that meet basic requirement for surgery. So harus tahu standar-standar ini, jangan asal because of cheap I will do it. No, you need to be safe also. It's about your life. Okay, next. So sebelum melakukan operasi, if you are a patient, please make sure are you healthy? Apakah Anda sehat? Apakah Anda memiliki penyakit sebelumnya seperti darah tinggi, jantung, ginjal, dan lain-lain? Dipastikan sure dulu dan medical check up, dan harus mengerti, tanya ke dokternya, apa komplikasinya, apa yang harus saya lakukan, understand fully about surgery. Jangan, okay, I want to be beautiful and I don't care everything. Jangan jadi pasien yang seperti itu. Ya, next. Ya, mencari plastic surgeon yang kredensial, accreditation, ya, yang certified juga, ada training dan experience, dan sudah memiliki banyak result. Dan Dr. Marco in this case, Dr. Marco is one of this plastic surgeon in reachable in Asia. He practiced in Brazil, also in Singapore. So next. So also we need to ask, itu operasinya ini dilakukan dalam anestesi apa? Lokal atau umum? Jika umum itu total tidak sadar, apakah ada dokter anestesi yang standby? Itu harus kita tanyakan. Kalau enggak, kalau sembarangan bisa itu dengan waktu singkat berangkat, hilang semuanya. Jantung bisa berhenti, darah bisa drop. Itu sangat perlu kita tanyakan. Apakah anestesinya berpengalaman, anestesinya apakah yang baru lulus dan lain-lain. It's really, really important to ask about everything. So next. Yeah. That's I told you before. Is it cheap? It doesn't mean cheap. It's health. With a health and really proper equipment. So apakah klinik memberikan instruksi mengenai surgery? Harus kita sebagai pasien juga pintar ya, kita harus tanya bagaimana prosedurnya, harus apa, setelah, dan pastikan harus tanda tangan informed consent. Kemudian menanyakan kepada dokter apakah Anda mengerti, apakah saya kurang mengerti, apa yang harus ditanyakan sebelum operasi. Dan biasanya akan dilakukan photo session sebelum dan sudah operasi. Dan seharusnya sebelum surgery tidak boleh makan dan minum. Ya, next. Ya, ini equipment-nya dari Rumah Sakit Dr. Marco. Ya, terima kasih. Sekian patient safety. Nah, ini we will continue to answer few of the question. So I've got already few of the question. Okay. From Angela, from IG. So we are also online in IG. So few of people asking how long the recovery to avoid infection and the risk of complication. Please, Dr. Marco.
Yeah, the risk of complication, we are talking about the Brazilian butt lift, the risk we discussed before, the embolism, deep vein thrombose, not deep vein thrombose, the fat embolism is the one that technically was quite circumvent now with the new way of doing after some accident. Infection is not frequent in my whole life that I have done a few thousands of this. I remember 2 cases of infection in fat grafting in the butt that easily to treat. Absorption, partially absorption is one of the issue for people that keep doing a lot of exercise just after that and do not care in terms of sitting straight away on top of that, but not much complication in terms of infection. And after, let's say, a week already, all the wound very close and remove stitch remove, and then you can have back to normal activity since 1 week.
Yeah. So Angel, so she is in Instagram. So ya, jika dilakukan di dokter yang tepat, so the risk of infection we can reduce if you choose the right place, the right surgeon. It's about that. It's about the patient's experience.
Doing in a proper environment, in a proper surgical room, and not in the clinic with poor sterilization. Yes, this is mandatory.
So, as beside of the emboli, what kind of complication it may be happen?
I think the embolism or infection should be the
What?
two
Yeah.
more important risk, but the only really severe risk should be the embolism,
Yeah.
because the infection is very rare and easy to treat when have infection about that. But I don't see other risks in terms of fat injection. In the gluteal implant, more in terms of extrusion, infection of the gluteal implant because of foreign body. That's why it's not my number one choice.
Okay. So there is another one. Thank you, Dr. Marco. Another one. What we need to prepare ourselves before we do and decide this surgery. So apa yang persiapan harus dilakukan sebelum kita melakukan
Yeah,
surgery?
just full medical checkup. Do prepare, have time for resting 2 3 days, and yeah, full medical checkup. Be in good health condition. Be sure that you don't have any skin infection before going for surgery. Not a flu, no sinus, no one infection in your body, urinary infection. Do a medical checkup before the operation.
Okay, so the medical checkup supposed to be minimal few months before. How long?
No, no, close to the operation. When you want go for operation, you need to know that you are healthy enough with ECG and so. But always just a few days before the operation, I will repeat the blood test and urine test to be sure that there is no sign of infection in the body.
Okay, so yeah, if anybody still want to ask, you can type also here, please. Bisa bahasa Indonesia, bisa bahasa Inggris, terserah. Dipersilahkan yang mau bertanya. Oh yeah, there's one here from Instagram. Okay, so it's about incision. It's about the wound, yeah. Where will be the wound? It's
Uh,
big. How long the wound?
no, for the butt implant is like say this big in the intragluteus fold. For the liposuction with fat grafting are 3 millimeter, many 3 millimeter incision in the area that we do the lip sculpture, and through the same 3 millimeter incision we inject the fat in the gluteus area.
Okay, there
Very
is one. Leah, okay. Okay, Dr. Leah, please, we will switch on your microphone. Feel free to ask to Dr. Marco.
Okay, can you hear my voice?
Yeah.
yes.
Okay, hello, Dr. Marco. I'm Leah. I'm a psychiatric resident in Bali, Indonesia. I was asked by Dr. Christabella to join this Zoom meeting. So I don't want to ask you about lift, but can I ask you about silicone injection, because Dr. Christabella also talked about it before. Like, I have a friend that she's in anti-aging like medical degree. We know that it's not a specialization program. Dr. Christabel also know that in Indonesia we have a kind of that program anti-aging, and she told me that it's proof that, but I don't know the source, but she said that it's proof that silicone injection is better if we do it before we are 30 years old. Is it true or not? And why? If it's not
No,
true, why? If
no.
it's true, why?
Silicone injection, never, 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 never,
Never, never. So
never.
it's like it's not
Silicone
allowed at
injection
all.
is absolutely wrong, and people that do
Okay,
that suffer for a lifetime because that causes
okay.
a lot of issues. And we are seeing some patient going to the saloons, and
Oh,
doctors are not doing silicone injection anymore.
yeah.
And still in some saloons doing, and we still see rich people, rich Indonesian ladies going for some saloon, and after that regret with a lot of silicone injection in the breast, silicone injection in the chin, silicone injection in the face. That is a problem for lifetime. In the
Yeah.
breast, after that, the breast become lumpy, and you do a mammogram, you cannot see. No, good that you brought this to
Okay,
silicone injection, please.
but
Never.
but I think it's important for you to know too that I think some doctors in Indonesia still do it. Like
My
do it.
goodness.
Yeah.
No, it's not other kind of fillers
Okay.
because there is also a filler that proper to inject in the butt, and that is a kind of hyaluronic acid, but very thick, that can be used for the butt. But silicone was banned from the use for so many years already. Is really not advised to.
Okay, so it's good for me to know that because I still heard from some friends or like some people that they went to saloon or they even went to some doctors and they got injected by, with the silicone. So
Mm,
thank you for
mm.
the information.
Welcome. Thank you for
Eh,
bringing the subject because this is something very,
audience di
very.
sini tadi Dokter Lia dari Bali ini bertanya mengenai apakah aman ikut menginjeksi silikon. Oleh karena itu ya, honestly in Indonesia a lot of doctor, a GP, they can have a license of aesthetic, they inject everything. Sometimes mereka inject itu silikon, tapi mereka bilangnya itu adalah filler or something. So make sure as a patient, you see the doctors open it in front of your eyes and inject it to you. Please don't be really silly, do silicone because it's really hard for plastic surgeon to remove it later. It's really complicated, a lot of complicated. Silicone, liquid silicone that, okay. So, seperti itu yang tadi ditanyakan Dr. Wati. Thank you for the question. So, please feel free. Silahkan yang mau bertanya, dipersilahkan kembali jika ada yang bertanya. Oh ya, ini there is a one question from Instagram. How about injection aqua gel? Is it silicone?
Yeah,
Yeah.
aqua gel is not silicone, is a kind of filler. Yeah. Then aqua base filler should, if the doesn't come mix with some other kind of product that was the article that will have the aqua gel mixed with some kind of surgical cement. Okay, if just aqua gel, it will be bit by bit absorbed by the body. Should not be any issue. Should be some that just inject and after that goes away. Yeah.
So there is some people that like advertisement in Indonesia that it will be gone after 5 years. Is that true?
Something. Yes, normally it can be absorbed, depending what kind of fillers. Some are fully absorbed, some stays part of it, depend uh, what kind of filler.
So kita bicara mengenai new product di Indonesia yang lagi ngetren yaitu Aqua Gel. Dr. Marco dan saya dan ini Angela sedang membicarakan mengenai itu. Menurut Dr. Marco itu adalah safe selama benar-benar aqua gel dan akan hilang seperti yang diiklankan. Itu akan diabsorb atau diserap tubuh kita 5 tahun ke depan. Jadi, but seperti yang kami bicarakan tadi, make sure sebelum diinjek, benar-benar dokter itu membuka semuanya in front of your eyes. Open everything in front of you. Yeah, in Indonesia, a lot of doctors just inject everything behind us. They say that is a filler, there is everything that not really dangerous. That's why we, as a patient, we need really to be smart. Thank you, Angela, for the question. So, any question again? We have 5 minutes more. So, okay, here. Oh yeah, there is one question here. It's out of the topic, Dr. Marco, but they want to ask about thread leaf. It's interesting, yeah. Maybe we need to talk about facelift next time.
Yeah, we should do another. So let's see how is the public interest. Then we can also go for more.
Yeah. Di sini ada pertanyaan mengenai thread leaf yang lagi ngetren itu. Apakah itu safe? Is that safe for? I heard that is make necrosis for face. Is that true, Dr. Marco?
Necrosis, I never seen necrosis, but infection, extrusion, and not lasting long is the main issues about. Or if the doctor doesn't put in a right place, a bit superficial, people can see the line of the thing. I do not and I do not recommend this because it's very short time the result and carrying some risk that without benefits, really benefits. No, not something that will benefit a person for long term. No, and carry risks, and so I don't see this thread leaf like something that I don't put in my practice the thread leaf, no.
Okay, so thread leaf menurut Dr. Marco
But
ini
I know there's many doctors doing. I'm not condemning, and if the patient want to do, just go for someone that's good in doing that. I prefer doing my facelifts.
yeah.
That's more lasting, more thread leaf. Like say, if you suddenly you have a party and want to look better, and knowing that in few months you don't have the result anymore, go for a good doctor in thread lift. You can get a temporary, maybe good result, but doesn't last long.
Ya,
And
jadi
complications also have complication, also can have hematoma, can have infection, can have as much complication as a surgery, and doesn't last much the result, in my
ya.
opinion.
So, opini Dr. Marco bahwa thread lift itu kalau dilakukan dokter yang tepat boleh, cuman tidak direkomendasikan karena efek sampingnya juga sama, bisa biru-biru, bisa kena nervous atau syaraf, mahal juga, tapi tidak dalam jangka waktu yang lama. It doesn't really for a long time. So, ya, waktu kita sudah habis. So, time flies so fast. Thank you for joining us. So, this is, we recorded this, and maybe next time Dr. Marco and me can post to our Instagram. And thank you so much for joining us today. Maybe we can talk more about another series, Dr. Marco, when you have time later.
Yeah. Okay. Thank you, everybody, for listening
Good
us.
night for Indonesia. Good night, all.
Good night. Bye-bye.
Good night.
Thank you for. Thank
Bye-bye.
you.
Bye.
Good night.
Bye, Dr. Marco.
Bye, Marta. Bye-bye.